So Justin?
Yes.
How does this start? Do we just start right at 5:30 with my talk show host voice?
Yes, that's what I would recommend.
Okay. The sheriff asked me if I'd use it.
No, I threatened to kill you if you use it.
Yeah, your voice.
Oh, yeah.
No, yeah.
Oh yeah.
He loved that voice.
You could take a poll, right, Beth?
Absolutely.
You know, but Robin really is a DJ, so I wanted her to play some music for us. I think that would be good.
You know, I thought about that.
That would have been great.
Pre-music. Yeah, next week or next time.
Promise.
This is totally like being a DJ, like where a minute feels like a very long time.
Yeah, like that.
Well, good luck, everybody. Thank you for
Hey, Stu.
joining us. Thank you for putting it together. Appreciate everybody's time. Very excited. So
Hey, Stu, happy belated birthday. Your birthday
Yes.
was yesterday, right? Happy birthday.
thank you, Stacey.
We sung to him today. It was really bad.
We spent some time together.
Don't do birthdays on Zoom. Exactly.
No, it's pretty bad.
We forgot to do the happy birthday for you, Stu.
Hey, Beth, don't forget that when you have this up, I can't see everybody, okay?
Okay, so what I'm going to do is when I'm done, I'm going to pull it down.
Okay. Okay, everyone. Thank you for being here. We're going to start in 2 minutes. I'm going to start us off, and then Beth will lead, and then we'll get our audience involved.
Guys, it's Alicia.
Alicia.
Hi, Alicia.
I just wanted to say that I'm here. My daughter had surgery yesterday, so I may have to jump off.
Oh.
And I was wondering if maybe, should I be invisible and just called upon as necessary, or do you want me to have my name up here?
We would love for your name to be there. I think the way we're going to do this is that when we talk, we'll introduce ourselves. I'm not going to introduce everyone. I can't see everyone. That's part of why.
Okay. Great. And
Okay.
do you want, sometimes the protocol is we don't show our faces unless we're presenting or talking. How do
No,
we
you
want to
should.
do that?
I want to see your face. I don't know.
Okay,
I
I'm
do.
here.
All right, we're going to get started. It's well, no, not quite 5:30, depending on the clock.
We have 14 attendees so far.
Awesome. All of our loved ones.
Robin, did you get the info I sent to you?
I did. I've got it right here. I'm all ready.
Oh, thank you. So ready.
I've spent a lot of time in a radio chair. I do miss it. It's one thing I miss a lot.
I can see that. That'd be nice that'd be a fun job.
It is a really fun job. It's a hard job, but it's a fun job. But somebody has to do it, right? Okay, it's 5:30. Ready to start?
Already.
Hi, everyone out there. Thank you so much for joining us here tonight as we look at the new normal, coping with COVID in the new world here in Mono County. I'm going to start you off by saying that my name is Robin. I work for Mono County Behavioral Health. We have some wonderful panelists here from your community, and we also have a special guest named Beth Cohen. I'm going to introduce her in just a moment. This presentation will take about 15 minutes. There's a poll, like a test you can take in the middle that's pretty fun. So do stay tuned for that. Please participate. You can put your questions in the chat box, or you can call in and we will call on you once the presentation is over. And just really thank you so much for joining us. So I want to introduce Beth Cohen. She's a clinical and organizational psychologist with mass trauma expertise. She's worked with Mono County for a little over a year and a half-ish, I think, maybe 2 years now. We love her, so we're really grateful that she's with us today. She designs and implements trauma response and recovery programs and events for critical incidents such as natural disasters, mass murder and terrorism, and the COVID. She's also a professional threat assessor, a violence prevention expert, a national speaker, a certified meditation instructor with postgraduate studies in organizational neuroscience. And if that's not enough, she's also a co-author of an award-winning book, Work Arches, the Neuroscience Guide to Surviving and Thriving at Work. We thank Beth for being here, and welcome, Beth. Why don't you get us rolling?
Thanks so much, Robin. Good evening, everyone. Thank you for coming to tonight and being willing to spend some time with us. I actually wanted to talk about COVID-19 and how everyone seems to be doing. I've had the opportunity to speak to thousands, actually, of people across the country over the last 9 weeks, and it's been quite interesting in terms of understanding some of the complexities of COVID, and also understanding why it is that, if you ask yourself sometimes why it is you feel so exhausted, or why it is that you're finding that perhaps it's taking you longer to do usual routine tasks, all those kind of aspects. I wanted to talk about some of the unique challenges that are actually going on. And so perhaps, at least for the time I'm talking to you, you might end up with sort of a sense of why some of the responses or some of your behaviors, you might notice that you've been affected. So I want to first talk about sort of some of the psychological and social complexities of the pandemic. I'm assuming that this is your first pandemic. Unless you were born before 1918, this is all of our first pandemic. And I say that because there's many unique parts of this. Everyone knows, of course, that there is a virus, but the unique part of sort of the virus, or what we will call, some people are calling it the enemy, is actually an enemy that we can't see. So part of that in itself has been quite stressful for people. The fact that it actually has threatened our survival because there's potential that we could get some illness is also threatening for many of us. And of course, some of us are of different ages or have different medical issues. And so some of us obviously are experiencing more anxiety than perhaps others are around the fear of becoming ill or the fear of survival. But there is something absolutely also unique about this process. And that is that this is the first time, certainly in my life, I'm assuming it might be the first time in yours as well, where every other person, including those that we love, that we care about, that are our colleagues, that we are our family members, could potentially cause us harm. And not that they would want to do it purposely, but because the virus is something that we can't see, and because many people actually have some pre-symptom, have not asymptomatic, but as well as they could have no symptoms upon getting it, everyone else in our lives is potentially someone that could cause us harm. That to me is absolutely stunning. And I say that because, I have a son who I have hardly seen over the last 9 weeks, because he has been exposed a couple times, and each time he's exposed, he will come to me. He doesn't live with us, and he'll come to me and say, I know, now I have to stay away for 2 weeks. Even those we love, for those of you that might be caregivers for even older adults or dependent adults, it's also been incredibly stressful if we can't actually see those that we actually usually take care of. Now, there's also something else. Obviously, the resources that around this have been a problem. We've all tried to be able to make our masks and to do those things that we need to do to try to stay safe. But there's also another fear, and it's what we call in my office interfacing anxiety, actually. The fact that if we now are kind of having a reentry experience, and in that reentry, we are going to be interfacing with other people. We have had to interface with touching things that's, for a while, many of us were very concerned about as well. Interfacing anxiety is something that is real, and it's something that is causing some people some distress. Is how do we do this in a way where we can still stay safe? So if you think about the complexities, I'm going to add another layer. And this layer is where some of us have experienced layoffs in our families. Some of us have financial issues as a result of what's going on, not to mention a significant lifestyle change. And of course, just to top it off so that we really can perhaps, experience some level of more discomfort for some of us, we have an unknown right now and an uncertain future. And all of that can cause and create certain emotional and psychological distress that many of us, and even physical distress, that many of us may not actually even expected. So as I talk about this, I also want to talk about what it's been like for you to manage work and life. And please feel free to add anything in the chat. I know that this is the first time certainly that I've lost my village. My extended family is not able to visit and I'm not to see them. If you have kids in school, you've lost your village called the school. You've lost villages of your neighbors. The losses around that are significant, as well as the stressors that's occurred as a result of being home, having to do school at home, perhaps if you were responsible for that, or also needing to accomplish your work and accomplish your work responsibilities. Again, as I said, if anybody's exhausted, please know not only are we earning it, but what we're seeing in data is that we right now as a globe are quite very, very exhausted. There are also obviously health and well-being concerns, and on a number of levels. For some of you, who are and most of us are fortunate not to have COVID, but for some of us, we have health issues and we're not going to the doctors out of concern that we could catch it there. We are not seeking assistance if we are having some emotional stuff going on, even in terms of counseling. So one thing I want to say to you is that many doctors right now and most clinicians and counselors are right now, the good news is they're actually doing medical appointments and psychological appointments, counseling right over the internet, which is really, really fortunate. And I already talked to you a little bit about that interfacing and reentry anxiety that is starting to come as we are heading more into life and as we are heading more into sort of our ability to start to, some of us are asked to now go back to work, etc. So I want to talk to you a little bit about what it is that's creating what we call the threatened brain right now. And if you take a look right here in what we call the emotional center of the brain, it's actually called the limbic system. I love to teach through the sciences, through the neurosciences, what's happening with our brain, because it actually tells us why, but it doesn't have a lot of judgment to it. It's just how we're all wired. We are wired to survive. That is how we're wired. And because we're wired to survive, what will happen is that if, in fact, we in any way, our senses, whether it's our eyes, our ears, our taste, if our senses experience something that is a threat or a strong emotion, we are going to end up lighting a part of our brain called the limbic system, which will put us, and many of you probably have heard this before, it will put us in what we call a fight, freeze, or flee space. We will want to try to fight, flee, or freeze. And when I say that, it's because when we are in this state, guys, we are not necessarily able to think as clearly as we would. Hence, I know for myself, it has taken me double the time to do many projects, and a lot of my work, it takes me double the time. And part of that is that my focus and my concentration has been impacted, and therefore my productivity has been impacted. So I say that because if anything, I want you to understand that these are normal responses. And many people that I talk to, many of my colleagues are saying the same thing, that it's just harder right now to focus. And part of that is because the emotional fear center, the threat center of our brains are actually lit up more than this part of our brain, which is called the neocortex, which is where we take information in and we're able to think very clearly. We call it the wise brain because we're able to think clearly and there's not as much emotion around it. There's also, if you think about this, and it's really kind of interesting, is that when our emotional fear centers are kicked off, we also will end up kicking off adrenaline, which if you're exercising, most of us know, right? If we're exercising and we end up hopefully having a bunch of adrenaline to give us energy. But if we are not exercising and we are sitting with a lot of adrenaline in our body, it's exhausting. It takes a lot of energy. The other thing as well is that we will secrete a stress hormone, which is called cortisol. So when this fear center is open, turned on, that's what will happen. We also will feel the sense of what we call vigilance, which is where our bodies will just sort of stay in a vigilant state. So for some of you who might be having trouble sleeping or might be having trouble relaxing right now, please know that if that emotional fear center is on, we will have trouble sleeping. And right now it's really been kind of interesting in terms of some of the data that my office has been collecting, because there is we get in the thousands of people that I have had a chance to present to, over 50% have said that they are now, over the last 3 or 4 weeks, having a lot of trouble sleeping. It also creates some emotional dysregulation. So if you notice you're more moody, that's why. And the other thing that it creates is it creates what we call binary processing, which is a fancy term for merely we will start to think in a very kind of two-way process, right, wrong, things where we will not necessarily see the gray area much in life. So I say that because it's very important to understand that this is how we're all wired. And this is sort of a chronic state that many of us are in across the nation and across the world right now. I don't mean to be depressing, so I'll apologize. Take a look at some of these specific psychological responses to COVID. These are some of the sort of, certainly, some of the responses that people have been reporting that I've had the opportunity to talk with. So take a look. So obviously anxiety, worry, fear probably isn't a surprise. There now is, as we're getting closer to the reentry, sort of the responses of either having compliance around PPEs or not being compliant, around some of the things that we're being told to do to stay safe. Many people, unfortunately, are feeling, as the weeks are going on, more isolated and more alienated if they are not socializing. I have this wish, and I'll tell you what it is. My wish is that it would have been called physical distancing rather than social distancing, because for many that I talk to, they believe that social distancing meant that they had to be alone. So we're now seeing not only an increase, and Robin, you and I have talked about this, right? Not only an increase in isolation, but also then an increase in depressed mood, unfortunately. So I say that, so take a look, guys, see what you relate to in these terms. Let me define some of them for you. Otherwise, you'll probably know most of them. There are many people who are just feeling invulnerable, that this really is, they're invulnerable. Nothing will happen to them, even if they do get the COVID. There's something called trespassing confusion. I don't know if anybody knows what that is. Trespassing confusion actually is the confusion we have right now on who to believe. Who do we believe about what is going on? And part of the confusion actually is that some people who are not actually real experts in medicine, in science, some people who they're sort of coming out and they're telling us things that we actually, that really are not necessarily based in science or based in what it is that we know to be true. So part of that is called trespassing, because they're like crossing over into an area that they ought not to be in. We certainly have been seeing more feelings of and responses of inequity and unfairness. All of these sort of experiences are normal. FOMO, many people, especially those who are not going out much, are feeling a fear of being left out, of missing out. So I say that because the other piece that's important to understand is that when people are in a level of chronic stress, as we have been in over the last 9-10 weeks, there also can be what we call an exacerbation of pre-existing conditions. And what that means is that if you have a history of medical problems, a history of mental health problems, even a history of trauma, either childhood trauma if something happened during your childhood, or acute trauma if some kind of critical incident has occurred, all of this stuff, this level of chronic stress that we're under, can end up kicking off, or what the term is triggering some symptoms that we otherwise quite often might have under great control.
So Beth, can I add something into that?
Absolutely.
Or do you want to go right to the poll?
Nope, please do.
Before COVID entered into our lives here in Monroe County, the Behavioral Health Department for the county was helping the community speak about and deal with a number of suicides that we'd experienced in a short period of time, and also some other deaths of people kind of in the same age range. So there was a lot of grief and worry and concern already. And we did a presentation at the end of February, and at that presentation, one of the things we came up with from community input was that people were feeling isolated and lonely. And so my department and others that were there, some of whom are on this panel, were starting to talk about how do we reach in. So one of the things that we're hearing about now is there was a period of time where I think people were really focused on just getting kind of their response to COVID, and whether it was working or being laid off or whatever was happening, living alone or living with a bunch of people, and trying to just kind of focus on that. And now that we're starting to open the world back up a little bit, we're really seeing people kind of going back to this place where they were already lonely, they were already having a struggle, they were already feeling like maybe it was better that the world didn't have them in it. And now we're seeing people really starting to go back to that place. So I want to give some information about what to do if you're feeling like you don't want to live, if you feel suicidal, or you're worried about somebody in your life who might be. If you call our department, we will help sort that out with you. We'll have all the information at the end. I'll give you the number right now just because I will forget, because as part of COVID, I forget pretty much everything now. 760-924-1740. We know it's happening out there. We are really concerned about people not feeling connected. And so this is a way for people to get connected and maybe get some help to get through this next period of time that we have. And thank you, and I'm sorry to interrupt.
No, you didn't interrupt, Robin, and thank you for saying it, because as the weeks are going on, certainly in our data that we're collecting, we are seeing, as I said, some increased mental health issues that are concerned. And part of it is that, guys, we as human beings are social beings. We are not meant to be alone for long periods of time. We need to be interacting. Now, when I say alone, fortunately today we have a virtual experience that we actually can use, these platforms. I know they're not perfect, but they can allow, we still have telephones. Social distancing is not meaning we can't be social. Social distancing means that we have to stay physically apart by a certain level of distance, usually at least 6 feet. For some, they might want to stay even further apart. That doesn't mean, though, that we can't be social. So thank you, Robin. I'd like to run a poll. This is a poll that we've been, in my office, we've been collecting this data. And if you want to throw, I think I'm throwing up the poll. So let me pull it here. If you take a look at this question, you'll see that which reactions have you been experiencing? And by the way, you can answer any or all or none of the above, but and I'm going to launch the poll right now. Which reactions have you been experiencing? Fear, anxiety, overwhelm, worry, hypervigilance, exhaustion, sleep difficulty, focus difficulties, reduced productivity. And anybody can just start. In order to use this data, if a lot of you guys would answer, that would be great. I can use the data if about 80% of you can answer. So I know if some of you don't really like to answer these, if you would be so kind to me. We are using this research to provide it to state government. We've been providing it to federal government, to local government, city government, and counties. It's been very, very helpful for having this information, and how actually our moods, or quite honestly, are changing as we go week by week. So far we have 50%. Anybody else consider answering? That would be lovely.
It's anonymous, correct?
It's all anonymous, guys. You are not, no one knows. It's an anonymous poll, and it really gives you a chance also to do some self-reflection. How have you been feeling? And what reactions have you been experiencing? Many people aren't necessarily asking us that, but these are difficult times, and we've all been affected. So how about if I'm going to wait another 10 seconds before I end the poll? I appreciate it. You guys were kind enough to respond. All right, we're going to end the poll. And here you guys can see, I hate to call it a winner, but the red is called winner. I don't know why we call it that. But those of you that responded the most actually responded that 60% responded that fear, anxiety, overwhelm, worry is really very concerning. Take a look though, guys. In the first couple of weeks, the percentages that our attendees would respond, guys, was anywhere from 10 to 20%. Now people are reporting 50% being exhausted and having sleep difficulties, and over 50%, and this is across the nation, of focus difficulties and reduced productivity. Now, I can't necessarily, I know that that doesn't right now help you, but what I want you to know is that this is a normal response for what's going on right now. So I'm hoping at least that we normalize it. We're also unfortunately seeing an increase as the weeks go on in the sad, kind of depressed, isolated, hopeless, helpless experience, as well as anger, frustration, and irritability has been increasing. And I'm so glad that none of the above. I'm hoping those individuals are feeling fine and feeling still resilient, and that's wonderful. That's wonderful. So take a look here. I'm sorry I didn't share these right away. I apologize to you guys. So take a look at the results. And you can see here that 50% and then 40% also reported anger and frustration as a result of some of the cultural unrest that we have right now. Last week, we actually saw an increase as well in anger, frustration, irritability. So you'll know. So let me move on so that I can be, let's move on from this and let me just finish up here for you guys. So here. So I want us to talk a little bit about what it is that the strategies to build well-being and resilience, because this, by the way, is what allows us to quiet down that part of our brain called the limbic system, which is that sort of that emotional center where our threats get turned on and we end up feeling in this vigilant state. First of all, I want you to know that well-being is a skill. It can be learned at any time. Any age, it can be learned. It's something you can do. So, but what we need is a number of ingredients. It's like learning a new musical instrument or learning a new sport. You need the intention to learn it. You need to make a commitment, and you have to be willing to repeat over and over again and be a beginner at something so you can practice it. So I want us to talk about that in terms of some things you can do. Self-care is vital during this time. So for those of you who tend to it's not as easy for you to be you do self-care, or you kind of feel guilty, I want to invite you guys to give yourself permission to have good self-care. It's very important. There's a lot of maladaptive coping that's going on. It's very important to sort of figure out what you might be doing. A lot of people are using food. Some are using alcohol. We're seeing increases in alcohol. We're seeing increases in drug use, unfortunately. And that's maladaptive coping. But there's a lot of ways to do adaptive coping, like, for example, having some virtual social connections, whether it's over the phone, whether it's using some of these platforms, creating very realistic expectations of what you can and cannot control. Using mindfulness practices, all the research is amazing in terms of how it turns off that threat center in our brains and allows us to move into a relaxed state. Distraction strategies are great. Body time, become physical. You guys live in nature. Go out to nature, do activities. And also remember to assess your own feelings and responses. And please, like Robin said, seek support. And you may not even be in crisis. You might just not be feeling yourself lately. Seek support. If you go to counseling, guys, it's confidential. And, so you can kind of have a safe place to talk. And if you decide to go to other friends or colleagues to talk to. And also, what we're recommending is reducing some of that information and some of the potential news that people are watching. If you're watching news right before you go to sleep, I promise you, the likelihood of you having an interrupted sleep is higher than if you don't watch or see news or read news before you go to sleep. So I want to end with this. We are all right now pioneers, and we are all navigating uncharted territory. And most of us really are not even sure what the course map is in our compass. We're not sure about our timelines. All of that can be jarring and emotionally exhausting. All of that can happen for us until we sort of can find sort of a map that we can use. My recommendation is to try as much as possible to stay in your present, to not think too far in the future. Planning in the future is different than worrying about the future. So I have also offered a few great, and these are all free, and these are some phenomenal apps that you can try if you guys have app capability. This is COVID Coach, for those of you who haven't seen it. It's a newer app and it's very good, actually. This one is a mindfulness meditation app from the University of Wisconsin-Madison. This one, both of these over here were created by the military. and PTSD coach specifically was created by the VA. So I am going to end here, and I want us to be able to open it up with questions and comments, and I'm going to give it over to my colleagues at Mono County and City.
Wow, that's a lot of information. So you have a panel in front of you. We encourage you to ask your questions in the chat box, as it's known. I'm learning all kinds of things now that we're COVID responders. And in the chat box, you can ask questions or make statements or whatever you want to do. We also have a phone line available. And in the meantime, I think I'm going to open it up to the panelists. If there's questions you have or thoughts that you have related to what Beth's talking about, maybe you have your own experiences with some of what she's talking about. I can say, just starting it off, that it's always helpful for me to know two things from what you do, Beth. One is there's a neurobiological answer to the question here of why I'm feeling the way that I'm feeling. And I certainly feel a lot of the things on that list. And I forgot the second thing. So there you have it. There's COVID right there, up close and personal. Who else out there? Got a great panel. We've got Linda Salcedo from the town council. We have Supervisor Corliss from the Board of Supervisors, Cassandra Montes and Stephanie Valadez from Mono County Behavioral Health, and Sheriff Braun are all here with us today, plus our two moderators. Did I miss anybody? My iPad and all. If you're on mute, please unmute yourself.
Robin, I'll jump in. This is,
Okay.
I did want to clear up, if you do have a question, there is a chat box, but there's also the Q&A, and the Q&A is the appropriate space for questions. So if you have a
Correct.
question, please
Thank you.
put it in there. Yeah, and then I'll kick it off with a question for Beth regarding kids. I'm selfishly going to ask about kids. What, you know, I have a wide range of ages with kids, and I often wonder what they are experiencing and what they feel right now. And then I wonder long-term what you think the impact of this, you know, pandemic and isolation and experience that they're going through will prove out to be.
It's a great question. You know, with children right now, what I'm recommending actually, Justin, is for people to be able to have conversations with the children at their appropriate developmental age, right? So many children are not able to even describe because they may not have the vocabulary, a psychological or a feeling vocabulary even, right? But that doesn't mean that we still can't have conversations with them. What I'm seeing with children is that there is a level of isolation. Children by nature want to play. And there's been a reduction in play so significantly that some kids are really having a very hard time. I talked to yesterday, an individual who actually teaches disabled and special education in the school district. And it was so sad to me because there was an inability even they've been working so hard with some of the special needs children, and he ended up seeing some because it was the end of the school year, and although they were distant, and they couldn't even really give him eye contact. So we're seeing some real social changes as a result. Some of the concerns, I don't know if you guys saw this too, where virtual school wasn't what we thought it would be. Has anybody seen the research that's now coming out on that? I have not only felt badly for the parents, but I have felt very badly for the children to have to school at home. What long-term effects are we going to do? We're going to start seeing, my concern is that we're going to see some development slow down. That doesn't mean kids don't catch up though. But one of the concerns that I'm seeing child experts talk about is development slowing down right now. So that is also a potential.
Thank you.
You're welcome.
Got a couple other parents on the panel. Do you guys want to chime in? Stephanie or Alicia, that have parents of kids that are at home now.
Yes, hi, my name is Stephanie Valadez. I work for Mono County Behavioral Health. I am one of those parents that has struggled, and my child is probably one of those children that's probably been affected by my teaching. One of the things that I've personally struggled with is working, which seems to, it's weird. At first I thought working from home would be a lot easier. It would be a lot slower, but it's the complete opposite. If anything, I feel like I'm working from the minute I get up till the minute I go to bed, because in between, yeah, I'm doing my work, my official work, but then it's breakfast, lunch, and dinner and snacks in between, handling the kids. So it's a lot more overwhelming than actually waking up and going to work and coming back. So I don't know if anyone has experienced that. Also, the difficulty of, like you mentioned, Beth, I don't think that this virtual learning was exactly what we thought it would be. At least for me, it turned out to be actually somewhat more work. And I mean, my child is just in second grade. I can only imagine the parents that have kids in higher grades and how much more difficult that is. Or the parents that have to deal with multiple kids in school. So it's been very, very difficult. And in our household, we've, what the other thing is, allowing our children to play outside, and how much do we allow that? And, because there's other kids, and kids by nature just want to hang out together. So that's been another concern for us. I think my question would be, and this is where I have trouble, is finding that time, or I guess, what is your advice on finding that that time for self-care? Because it's really hard to find when you're managing work and you're managing your kids, and you're not interacting with your natural support group that would usually watch your kids if you're going out to date night, or hey, I'm going to drop them off with this friend, or with my parents because I got to run an errand. So I guess, what advice would you give us working parents?
First of all, thank you for sharing that, because please know you're not alone. And one thing that I've been recommending is to really allow a great amount of self-compassion during this time. And what I mean by that is understanding that we are not going to practice the excellence that we're used to practicing as parents, as workers, even in our relationships and how we're engaging with people. I mean, it's just too difficult. So I've been going with the good enough standard. I know, Robin, you and I've talked about it a number of times, right? Like, what is good enough? And I say that because at the end of the day, your children will be fine. And at the end of the day, we're going to return at some point to our normal life. And we hopefully will also be able to return to that sense of feeling like we're more in control. The other piece that you're talking about too, in terms of self-care, is, I think the question becomes, how do you carve out some time during the day? And is it possible? And the truth is, for some of you, it's not possible. Or, if your children still nap, you kind of can rush for some alone time. But what I call self-care also is engaging in activities where your children are also sort of taken care of, and not in their village, because we don't have our extended village, right? So I've been recommending, at the risk of anybody being angry, is that if your kids like videos or a good television show, and maybe you're not big TV people, can you kind of maybe loosen some of your own sense of, how can I distract my children so I can have a few minutes alone? Or and even alone doesn't mean that you can still be in the same room with them if they're young children, but in which they're not needing your attention, right? How can you cook in a way where you perhaps can have everything in the freezer, so you can prepare things in the morning so that you don't have to be preparing 3 meals or 4 meals and snacks a day, to start thinking outside the box a little bit. And I'm not saying it's easy. I'm feeling very fortunate, actually, that my kids are grown. My youngest is at home and she's 19, which has a whole other complicated thing for those of you who have teens at home. But I really, really, I respect and I honor you guys who have had to school at home while you also have had to work at home. I'm hoping you'll look back at this time and think, I cannot believe I pulled that off.
Sticking to the theme of self-care, and this is Stacy Corliss on the Board of Supervisors. One thing I've really dealt with through this, being on the board and interacting on Zoom with constituents and talking to people on the phone and on Messenger, when you have your own fear, your own anxiety, your own anger, your own reactions, but when you're confronted directly with those of other people too, whether it's your kids or your other family members or in your job, what are some specific techniques, and I open this up to the whole panel, just for creating some healthy boundaries, or ways to say, okay, I have 5 minutes. I'm going to, go stand in my closet, scream, what's everybody doing to try to manage those things. So we're not always reacting, but, kind of okay to deal with it.
Yeah, Robin, you want to weigh in on, because you and I've had this conversation often.
I'd say get a dog.
Get a dog.
my
have
dog.
bought dogs.
What?
My dog, when I'm on Zoom too long, she may do it tonight. She weighs 85 pounds and she'll get in my lap and start barking at you. So yeah.
And
Yeah, right now-
Robin's dog
I've got-
makes a lot of,
They make a lot.
a lot.
I have 3 dogs, and right now they literally, like, it reminds me of when my kids were little, where they follow me into the bathroom, they follow me into the kitchen, they want to go, what are you doing, And yeah, so I think, kind of going off what you're saying, Stacy, and what you're saying, Stephanie, what I'm noticing I'm needing to do is create, if this is the best way I can describe it, is boxes in my time. So that, because what I will do is like, oh, I have like all these Zoom meetings or whatever's going on in my life, and then I will fill in whatever spaces I have with more work or talking to family, or all my family experiences now are electronic. I'm not a big phone person, and now I'm on the phone, or I'm having Zoom meetings with my family. I want to stay connected to people, but it means that everything's super intentional. And so I don't intentionally necessarily make time where I'm also going in the closet and just screaming or whatever, my equivalent of that. But I think what I feel like we've been doing is holding our breath for a long time, and we're still kind of holding our breath. And there's this idea that at any minute this will be over. And I think the answer is this isn't going to be over for quite some time. And so what I've done is, just for me, is stick 6 months. I have now a 6-month box. And in that 6 months, what are the things I can do? Can I get out of town? Can I go camping? Can I, what kind of breaks can I take in that 6 months? Because instead of doing this day-to-day thing that we're on, I mean, all of you that are in the public, in a way much more than I am, is that the information changes. We probably got another email about some change already while we've been on this. And it's hard enough for the public to keep up with that. I think it's also really difficult for you guys to be in the position where we're prone to lots of confusing information, and humans want certainty when we're scared, and we don't have certainty right now. I mean, we know we have some things. We can wear a mask and keep our distance, physical distance, and wash our hands. And those are things that we have certainty about. But outside of that, I think it's really hard. And I don't know if more people want to talk about that, because I also have a question for y'all.
I have a comment around what I call the hamster wheel. The hamster wheel of you take an action, and that action may have an effect on you, your family, your coworkers, your friends. And then so I decided I don't want to go to dinner in a restaurant. And then you say that, and then your friends are, but we really want to get together. How are we going to get together? I feel bad if you don't want to get together. And then the hamster wheel goes on to the next step of, okay, well, if I do go to the restaurant, and then the next step is, but if I go to a restaurant, I'm going to get sick, and everybody, and I find that even in the decisions we make on a day-to-day basis, as those people, that are sort of on the town council and the board, is like, we're making decisions that have real consequence. Mm-hmm. And whether it's us or whether it's people in their everyday life, that's what I find, circling around all the time. It's just that wheel of decision, consequence, decision, consequence.
The interfacing anxiety of as we begin to start to take more risk in our lives, or the people that we live with have to take more risk or decide to take more risks because they're going back to work, or they're over it and they just want to move on, or whatever the thing is, right? Like, how are we collectively kind of managing the anxiety of that, so that it doesn't put us in fight, flight, or freeze all the time, or become a concrete thinker? That wasn't rhetorical, that was a question.
Can I just, I'll just jump in really quickly. I just wanted to go back to Justin's comments about, and Stephanie's comments about homeschooling, and just my hat's off to the parents that are working so hard, and the teachers. Our teachers are have been absolutely amazing in trying to, I have a lot of friends who are teachers, and trying to find creative ways to connect with their students. I know they have huge concerns about losing kind of that eye contact, or the contact that they have with the kids during the day. And the idea of wearing a mask and not being able to, you know, you have to smile with your eyes so hard because they can't see your facial expressions anymore as a teacher. So anyway, I just want to mention a huge kudos to our school teachers. And I noticed we have a couple of questions, so maybe we should get to those.
Yeah, thanks, Alicia. Some really good ones in there. So this first one, could we speak a little bit more to those in our community facing massive economic uncertainty? What are some coping skills for that? And how can those of us fortunate enough to remain employed support our friends and family who are in a much more difficult place? The community is really divided right now between those who are out of work and those who are experiencing enormous work stress, and it's straining relationships. I think we've all seen that. It's either right now, it's all or nothing.
Yeah, one thing I've had a number of colleagues who have lost their jobs, Justin, who have, you know, when they get pretty upset when people talk about virtual exhaustion, because they would love to have virtual exhaustion if they were still working. This is again, you know, when we lose our jobs, when we lose our livelihood, I mean, it is a significant survival threat. I mean, it is scary. And you know, and the process, you know, that we need to do obviously is to, if you're able, you know, is to be able to see how it is that not only can you manage some of the fear, but also how do you allow yourself to create a plan so that the plan itself can perhaps propel some actions that you might be able to take. And I think what's happening, and Linda, the way you said it was really true, is that it's like a hamster wheel. Even when we create a plan, that plan seems to have some fear involved in the entire plan, right? So there's not going to be a perfect plan, but that's what I'm recommending is put together, like Robin was saying, put together a day plan, a daily plan, a week plan, a month plan, whatever you need to do in terms of what you're going to do to try to move forward, including finding jobs.
I think that's a great, especially in Robin, like you mentioned, we talk, and Linda, you talked about the, I've noticed the cycles or the waves, right? You have a couple of good weeks and then it's all of a sudden, and then it's a couple of good weeks. And so having that plan and that is a great idea.
I'd like to speak to the base part of that fear. I mean, I think when that question was asked, the first thing I wanted to do is suggest that we try to do something, right? Like, I think that all of us, when somebody that we love is hurting or in a situation that we can't help them with, we want to try to fix it. We want to try to create something that makes it better. And so I do wish that some of the what we'll learn from this meeting and the next meeting is how can we bring our community together? And are there things that we can do ongoing over time? Are there more things we can do? Because we're already doing a lot of things for the people who have lost jobs and may not be able to find jobs quickly. The other part about that is that all of us have been scared in our lives. All of us have faced things that have been very hard and very difficult. All of us. We all have some history where we've done something that has felt impossible to us. And what I really want people to remember is that connection is your antidote. It is the antidote. It is the thing that we have that keeps us afloat and moving forward. So even if all of the worst things are happening right now, we don't know what will happen in the future. That is the case, especially if you don't have a job right now, or if you're some of the people that don't want to go back to work but have to and you're scared. We still have to keep connection. So making phone calls, doing platforms like this, being on FaceTime, talking to people across the street, at a park, at a physical distance. And if you know people that are going through a hard time right now, please reach out to them regularly. It doesn't mean that you have to know what to do. It doesn't mean that you have to manage that urge that I have that you want to fix it for them. It's that you don't, because you don't, what we often do in the States here is because we don't know what to say, we don't say anything, and then people get more isolated. So if you know people that are struggling for whatever reason, reach out to them. Just say, hi, how are you? Can I, pick them a flower, or, pick them a legal flower. But do things that are about connecting with each other, because that's how we're going to get through this.
That's
And
a great
for those
lead into
people-
our next question
Well,
too, Robin.
Awesome. Go ahead.
Go ahead, Supervisor Corliss.
Oh yeah, I just wanted to add, I think another thing we can do, to get back to the question, what can I do to support my friend who, is out of work? I have a job. I'm maybe you're feeling more optimistic, but just, to listen and let him talk. That I think that's one thing I appreciate about our public board of supervisors meetings. Using this Zoom webinar format, people can just call in, or the community meetings on Thursday night, which we'll have tomorrow night. People can call in, they can write, we can just listen to them. And we don't have to respond. And like Robin said, most of the time we can't fix it, but we can just listen. And I think another thing is for us to realize and remind each other that we're not alone. Not only should we stay connected with our friends, with our family. I appreciate people I hardly know who'll send me a Facebook message and just say, are you okay? Wow, you're in a lot of meetings. That's so nice. So what I do, anytime I get one of those messages, I look at someone and I send them a text, or I pick up the phone and call someone randomly that I don't talk to. So, just continuing to kind of pay it forward and keep the connection going. But we're not alone, in Mammoth Lakes and Mono County. And especially us in the tourism industry all over the world, we're all kind of standing on the edge of this cliff. And I think we need to remember too that we have other resources and structures and things in place that we can work on this together, and maybe have a bigger conversation, continue to have these conversations as a community about what happens and what our future's like. I don't have the answer. I don't think anybody does right now, but we really are, especially when you getting back to kind of the economic question there, we are in this together because we've got to figure this out. And I certainly would be open to hosting, another forum like this just to talk about those issues if folks thought that would be helpful. And that's one thing I was kind of hoping to get out of tonight is, some ideas for healing and connecting our community as we move forward into reopening. And so now, go on.
Thank you. So this question, what is there to do about agoraphobic sentiments building in my mind as things start to open up? I've become much more scared to interact and engage in public, but I don't want this to continue past when it's appropriate or necessary. Great question.
Ooh, I want the answer to that one. That's happening to me too. Get a dog. That seems to be the answer.
Nilla has the answer, clearly.
What do you think, Beth?
This is going to be, I believe, Robin, and as you know, I've started to do reentry presentations, and reentry is not just for work. Reentry is just a life presentation, around dealing with this. I believe that there are a number of variables that are making it more difficult for us to feel safe in our reentry. And one is that many of us are not sure who or what to listen to in terms of that. So who is the trusted source? And so I believe that we have to decide who we are going to trust. And part of this is a mistrust issue. I don't know if you agree with that, Robin, but that's certainly what I hear continuously, and what I feel personally is I am not fully sure what is real and who to trust in terms of even, so for me, I am, as a psychologist, I trust science, and I trust medical professionals. And so that's what I understand. Now, I trust medical professionals, but I also understand viruses. And our medical professionals and our scientists don't necessarily know exactly yet what this virus is about. So they're going to have different information. And so what I learn in one week may be different than what I learn in another week. Right. So part of it is too, though, is if there's sort of this agoraphobic experience, I believe that people need to figure out small things that you can do, whether it's to walk around your house, outside of your house, whether it's to, walk to a park and back. so that you start to allow yourself to feel like what it's like again to be outside. And the truth is, Robin, you and I both know, we all know, is that it is not dangerous to walk outside. What is a problem is that we could be harmed if we're too close to other people. Thoughts, anybody else?
Just how tiring it is to go out.
It is exhausting.
You know, the mask and the this and the that and the even though it's not that big of a deal, at least the things I'm doing are not, I don't think are particularly risky, but just the fact that I haven't done them in so long, and that the looming worry about what could happen, like Linda was saying, you know, yeah, I think, and for me, I'm just trying to track how I'm feeling. I'm just trying like, oh, that's fear. So then just to like, remember like, oh, I'm scared, so that I don't like just kind of swallow all these feelings and not know what's going on and then wonder what's going on with me. Does that make sense to people? I think, yeah.
Has anybody taken drives? Because that's something that...
No drives. Yeah, I mean, we have one long highway. It's not like we can go anywhere,
Yeah,
really. I mean, you can.
Drive around the Vaughn's parking lot. Well, one thing that's helped me, and I am a horrific extrovert, so I am like me when I'm in, probably stand too close to people. I try not to, I'm sorry. I always have a face covering on, but I think this is where maybe some mindfulness techniques could really help too, before you go out, focusing on your breath, just inhaling to 5, exhaling to 5. One thing that's really helped me lately is just this really simple loving kindness meditation, and I just have it on my email right now. I'm looking at it. So if it was for you and you're feeling scared for yourself, you can say, may I be safe and free from inner and outer harm. May I be happy. May I be healthy. May I live and work with ease. Just something really simple like that. Maybe just take those breaths and then, prepare yourself to go out. If I do stuff like that, it really helps me. I promise I won't stand too close to anybody. So you don't have to.
I know you want to, though. Stephanie, you were going to say something?
Yes. So I can really relate to this as if it weren't enough with a pandemic, working from home, having kids. I am pregnant. So that is just something else on the, it's like the icing on the cake right now. So, it's been very different from all of my other pregnancies. And there's still not a whole lot of research, right? Because that's the first thing I did was I logged on to Google and like, tell me what you know about COVID-19 and being pregnant. And I freaked myself out. So one of the things that it's been working for me, I've been trying that climbing the anxiety ladder, right? Because I mean, I went from waking up at 3 a.m. because I couldn't sleep and doing my grocery shopping because I honestly thought I was safer if I went to Vaughn's at 3 a.m. to I actually just went yesterday in the evening, right? And it's just climbing that anxiety ladder where it's like, okay, my husband finally told me like, Stephanie, 3 o'clock, yeah, you gotta pace yourself. So then I went to like, okay, 6 a.m. and then, now I feel a lot more, I guess you could say normal going grocery shopping. I obviously take all the precautions that they do recommend, but it's just, I think we've been in this lack of a better term, isolation for so long, right? That we're scared to go out to the real world, right? So just taking little steps and knowing that, we're not going to go back to how it used to be from one day to the other.
I think that's interesting that we have similar experiences with the, going out. Everything has become such a challenge. I had a lot of anxiety in the grocery store as well. It's the only place that I really go with the face coverings. And I had found that actually listening to a podcast or music and really just focusing on the task at hand, which is unlike me because I feel like it's very rude to other people, but people can't see you smiling anyway. They don't know what. So it's really just focusing on getting through my list, listening to something else in my head, kind of getting me out of it has helped.
Distraction, right?
Distraction.
Yep. Again, I'm just going to go back to the dog. So, You know,
Hey, I would like to chime in too. This is Cassandra. Regarding, we mentioned about taking drives. I'm a podcast listener. I love podcasts. So definitely finding something that's motivational or anything that is, you know, comedy, whatever it is. I think that's what's given me a little bit of serenity on my drives, other than our beautiful lakes and mountains and beautiful sunsets that we have in this beautiful county that we live in. I mean, I think it's really important to make sure that we listen to things that are positive and give us a little bit of motivation, you know, to at least distract ourselves for an hour. You know, I think getting off the hamster wheel, I feel like, you know, we're always on a schedule, unfortunately, but I think it is important to make sure you have whatever, 15, 30 an hour to take care of ourselves. You know, it is maybe even driving to the parking lot of Vons and seeing people watch. I love people watching, but you know, you can sit there and listen to your podcast. And I mean, there's different ways to cope with this. So I think it's just maybe finding a way, you know, maybe looking back, what was it that you were enjoying before this pandemic started?
I agree. I drive. Oh, sorry. Go ahead, Linda.
Oh, no, I was going to say, I love going out for dinner. I really miss that.
I drive to Bridgeport, I don't know, 3, 4, 5 days a week because that's where my job is. And I think that would be a great way for somebody to start getting out. If they're afraid to get out in your car where you're still alone, but you can get out and see the world, because our world is pretty spectacular. And that's what keeps me going, is when I drive and I can tell how windy it is by the color of Mono Lake or just the sunset or whatever. But that is it's my alone time, even though I Zoom meetings while I'm driving quite often. I listen to music, it gets me out, it gets me alone, and it still keeps me, I don't know, integrated in society.
I miss buildings. I miss something that's angular and that you can just see the sides of. I thought of driving down to Bishop so I could see some building. I know that's weird, but do you want to answer that last one and wrap it up, or should we wrap it up?
So this last one is a little bit of a question on how we get the word out about these meetings and your department's services in general.
Okay. So I do want to say that this is an experiment, and I'm going to assume that it was a positive experiment for the panelists, and hopefully for those of you that knew about it and tuned in. It was something that we decided to do really at the spur of the moment. We did not get the word out in the biggest way that we could have, but we did the best that we could, which is going to be good enough for today. We are doing this again. We are going to do it again on June 24th at 5:30 to 6:30. That's a Wednesday. So again, June 24th, 2 weeks from now, 5:30 to 6:30 on a Wednesday. We will cover similar things to what we're talking about now. We would love your feedback. If you want to go to the Mono County Behavioral Health Facebook page, you can put comments on there. You can call our office at 760-924-1740. You can write any one of us an email if you have our email addresses, and just let us know, what would you like us to be talking about? What would you think would be helpful for yourself and our community? And how can we bring our community together? So the services that we have at my department, the Mono County Behavioral Health, is we provide individual and family therapy. We have psychiatry services. We have services for people that are struggling with drug or alcohol use. But the most important thing I want people to know is we want to hear from you. If you don't want to do therapy, that's fine. You don't have to. We'll just talk to you to help you with anything that you might be struggling with, or try to link you to any kind of resources that we might have in our community. We really want to be here for you as a community partner. And we know there's tons of stigma around reaching out to get help. What we're here for is just to have conversation. And we sponsored this today because we care about you, and we want you to, sorry, a message came up. I can't do two things at once, even before COVID. Anyway, so please call us at Mono County Behavioral Health. We're here for you. Or if you're worried about people that you know and you want to just talk some things through, we can do that as well.
Robin, I know we're just at the end. We had a great question come in right under the wire. Would you mind addressing that? Okay. The question is, it seems fear and shame have been used to drive behavior change in the population. What other tools, more positive, could be used to drive behavioral change?
Candy?
One of the things I do as the sheriff, because I'm often in uniform, so I'm looked at to enforce these rules about masks and distancing. Like if I go to Vaughn's, everybody looks at me if somebody's not wearing a mask. I try to do it in a more positive way and say, oh, you forgot your mask. And to have one that you could hand out to someone and be positive about it. And I still had some super negative encounters about it, but to empower people to do it in a nicer way, to remind people, hey, it's about, if you don't want a mask, that's cool, I get it, but it's about what's going on in the other person's head, and they need you to wear a mask. It's like wearing a shirt and wearing your shoes in the store. And if you don't like it, don't go to that store. But rather than public shaming and calling people out, it doesn't work. It embarrasses them, and then you feel like a jerk, trying to find the right words, for doing that. You know the words I like to use. But so that's one of the things I'd like to see more people do. Do it on a positive note, to encourage people to do the right thing for the right reasons, and not shame people and make them afraid of, I'm the one out there, with a badge and a gun, being super nice to people. Hey, you forgot your mask. And that seems to help. And people who see that in Vaughn's turn to me afterwards. Even if it's a negative encounter I have with the person, they say thank you. So at least there's that. That would be something I recommend.
One thing, oh, go ahead, Beth.
Oh, I just wanted to say, and I know we need to stop in a moment, but I also, thank you for saying that, Ingrid, because I also want to say that, everyone right now is being affected, right? So we are not, all of us aren't walking around necessarily being our best selves. Would you guys agree? I mean, we've all been affected, and that's really what we've been talking about for the last hour. So I agree with you in terms of really giving ourselves permission to practice that kindness, to know that, that we are all having a difficult time. And even if someone, let's say, isn't wearing a mask, that doesn't mean they're not having a difficult time, right? Or they don't need to be reminded. But the other piece that I don't want us to forget is how resilient human beings are. And we as human beings are incredibly resilient. And we are by nature, sort of amazing in terms of how it is. And if you look at the history, you can see all of our history, you can see that in terms of the ability for us to deal with adversity. And I think that many of us are forgetting that too, that if you can think about some of the hard times you've had before and how you've gotten through them, use that as a springboard to how you're going to get through this, even though this might be maybe one of the worst or absolutely the worst. And I think sometimes we forget that, to remember who we are just internally, or who we are as a community, and how it is we've gotten through hard times. But we do it, like Robin said, together. We need to do it together.
I have a friend, a fitness trainer, who always says to us in class, you have 100% record of making it this far.
Right.
But I was just going to add to that, you think like, what's the opposite? Maybe opposite of fear and shame could be, gratitude and pride. I feel grateful to live in a community where the majority of people care about each other enough to wear masks and to practice physical distancing and to have stayed home all this time. And I feel proud that we've made it here, and that we're in good shape, and that we've faced this together really pretty successfully. So, and that's the kind of thing I try to express when people write to me and say, I can't believe it, I went in the post office again and half the people didn't have this. Yeah, but half did.
Yeah, and I think what this forum is for, and what we hope we will talk to us about on June 24th when we do this again, is we're in this for the long haul. This is going on for a while. This hamster wheel is going to be moving for a bit longer, probably a long time. So how do we keep each other going? How do we stay connected? How do we keep each other understanding the importance of that? The more we stay covered, wash our hands, keep physical distance, the longer we'll be able to stay open. How do we make Mono County the best county in the state? Aside from our beauty, but how do we do that as a population of people with all kinds of information, all kinds of different ways of looking at things, but we know each other, we care about each other. What can we do to do that together? That's what we want to be here for. I think we're done.
Do a thumbs up.
See you in 2 weeks. Thank you very much.
Thanks, everyone.
Thank you.
Thank you.
Thanks for
Good
joining us.
night.
Everybody, stay
Good
safe.
night.